Even before the pandemic, under 18s who qualify for free orthodontic treatment on the NHS had to wait for months or years. Well, now the wait's even longer. The British Dental Association says there's been a collapse in patient referrals for orthodontic treatments because little or no screening is being done in high street dentists. And it estimates that at least half of patients who would have started a treatment this year just haven't been seen. Katie Robinson from Essex says she was shocked at how long it would take for her 14-year-old daughter to have braces fitted.
In June 2019, we had an appointment for treatment and we were asked to wait a year to make sure she had completed her natural growth. We were seen in September of this year and were told she was suitable for treatment. We were then told due to COVID and additional cleaning between patients, the waiting list we were now looking at was 3 years. I was so disappointed for her. Potentially, she would have been 17 before the NHS braces were fitted. We took the decision to seek private treatment, and £4,500 later, we are now week 4 into her having her braces on. This is not a decision we took lightly, but she is at an awkward age, and she was very insecure about her teeth.
That's Katie Robinson. Well, Hannah Chedsey lives in Bristol, and she's also worried about the time it will take for her children to be fitted with braces.
I've got 2 children aged 11 and nearly 13 years old. They both really badly need braces. I took them to the dentist in July this year and they were referred to an orthodontist. A couple of days ago, I phoned the dentists just to check on the progress, and I got a big shock when I was told not to expect to be seen anytime soon. Apparently, because of the pandemic, the waiting lists are not moving, and I could expect to wait at least 2 years for my children to be seen by an orthodontist. I was told if I wanted to pay to go privately, they could be seen within 2 weeks, but that would be a total cost of £2,500 per child, and we're not really in a position to pay for that. My daughter especially is really self-conscious about her face and really wants braces, and the thought of waiting till she's, 15 before she gets them done is pretty upsetting.
That's Hannah. Well, Anshu Sood is the Director of Clinical Practice for the British Orthodontic Society. Anshu Sood, hello and welcome to the programme.
Good afternoon.
Hi. There were already long NHS waiting times for children needing braces, weren't there? Why was that?
So I believe that the demand for treatment has just been outstripped by the funding these days. I think the concept of how children feel about the way that they look in this selfie culture, social media driven generation has changed over the years. And so the demand for treatment has caused high waiting lists across the country, and like you say, they have been extended due to COVID, and of course it is very distressing for patients and parents that do have to wait for longer.
Dentists are open again and they have been open for months. Why aren't they assessing and referring children the way they did before?
So I think there are 2 main factors that have caused that. And we have to remember that dentistry is already a highly regulated profession and we already have stringent infection control measures, but these have had to become even more extensive with the advent of COVID. We've had to increase appointment times to allow for cleaning and decontamination either side, so fewer people get seen in any one day. And we've also had to stagger appointments to allow for social distancing on the premises, so in the clinic, in the waiting room, the reception areas, again reducing the number of people that can be seen. So this lack of time and the lack of space has severely reduced capacity in both dental and orthodontic practices.
As we've heard, not everyone can afford to go private. We heard those 2 mothers.
Of course.
You can only have free NHS orthodontic treatment up to the age of 18, but the NHS told us that patients on a waiting list for an orthodontic assessment or a treatment, if they turn 18 during all this, they won't be disadvantaged. How can you make sure then that you are on some kind of official waiting list?
So I think for most of those patients, like you said, because the treatment waiting list has not been generated by COVID, it has been extended. Those patients that have already been seen for an assessment and are currently on a waiting list will still be allowed to proceed with treatment even after they turn 18. And so the NHS have produced a leaflet that is available on the British Orthodontic website. So that confirms that, and there's quite a lot of information there for any parents that are concerned about their children being in that scenario.
Some teenagers really worry about their appearance to the point where it gets serious and causes them anxiety. But physically, does it matter if your orthodontic treatment's delayed?
So from a clinical perspective, I think the vast majority of patients for a delay in treatment is not going to have any outcome, any difference to their clinical outcome. Regardless, of course, like you mentioned, there are a few patients who would certainly benefit from treatment being in a certain window, and that's normally related to a pubertal growth spurt. And so I think firstly what we need to appreciate is that it's not a small window. It is a window of years rather than months. And so those patients are unlikely to suffer any detrimental effects. And secondly, for those patients who have already been seen in practices, most practices will have a plan for those patients to be seen at that particular time so that we can harness that growth to get the best outcome for those patients. So I don't anticipate that there will be clinical problems from delayed treatment.
Anshu Sood from the British Orthodontic Society. Thank you.
Thank you.